Hello, my name is Rachel Stavanis, and I'm a Master of Science in Nursing student working on my graduate level project. I have created an educational PowerPoint to inform and educate readers about what bipolar disorder is, the causes, treatment options, the importance of medication compliance, coping mechanisms, and stigma in the community. Enjoy. Bipolar disorder affects 2% of the population in the United States. Bipolar disorder is a recurrent and chronic condition that will last for the entirety of a person's life. Bipolar disorder can affect daily functions in life and completing daily tasks, social relationships, ability to work, and mental stability. Here are some important statistics relating to bipolar disorder. Across the globe, bipolar disorder is the number 6 cause of disability. This relates to the next statistic showing that 82.9% of those with bipolar disorder have a severe impairment, while 17.1% of those have a moderate impairment. Bipolar disorder greatly affects day-to-day functioning. In the US, the most at-risk population for bipolar disorder is adults ages 18 to 29. 4.7% of adults ages 18 to 29 have bipolar disorder, which is over double the overall average in the United States of 2%. In Ohio in 2022, Ohio was ranked the 25th state for overall mental health care. This was a huge decrease from its number 11 spot in 2021. Once again, bipolar disorder is a recurrent and chronic condition involving depressive episodes and manic states. Mania involves symptoms of grandiosity or believing oneself is unstoppable and superior to others, rapid speech, sleeping less, racing thoughts, irritability, distractibility, and poor judgment. Hypomania consists of the same symptoms of mania, however, they are often less severe and do not affect day-to-day functioning. Depression involves symptoms of low energy, loss of hope, and unhappiness. Rapid cycling occurs when patients switch back and forth between mania and depression in short episodes that can fluctuate in length but occur at least 4 times in 1 year. It is very important to notice the symptoms of mania and depression, as periods of mania and depression should not be sustained for prolonged periods of time. Those experiencing manic or depressive episodes should seek out their psychiatric provider. There are a few different causes for bipolar disorder. The most common cause, involving 60 to 80% of cases, is genetics, while other causes include environmental conditions such as childhood or adulthood trauma, as well as the involvement of pre-existing comorbidities such as substance abuse disorders, anxiety, and personality disorders. Medication therapy is the first line of treatment for bipolar disorder. It is important to try to prevent the manic and depressive episodes associated with bipolar disorder through medications. There are multiple medications that can be used in treatment depending on one's symptoms. Mood stabilizers are one type of medication that work to decrease and prevent manic and depressive episodes by acting on nerve impulses in the brain. Antipsychotics are another medication that may be used to rebalance dopamine and serotonin in the brain. Dopamine and serotonin are both hormones that are involved in the mood regulation. Antidepressants are another medication that may be prescribed for bipolar disorder. There are many kinds of antidepressants, including selective serotonin reuptake inhibitors that increase the amount of serotonin in the brain, serotonin and norepinephrine reuptake inhibitors that increase the amount of serotonin and norepinephrine in the brain, dopamine reuptake blockers that allow for higher levels of dopamine and norepinephrine in the brain, and tricyclic antidepressants that allow for higher levels of dopamine and norepinephrine in the brain. Medication therapy may also involve the use of multiple medications together to help lessen the symptoms. It is very important that those with bipolar disorder stay compliant on their medication regimen. It is estimated that 50% of those with bipolar disorder are non-compliant with their medications. There are multiple reasons someone may stay non-compliant with their medications, including medication side effects, complex medication regimens, stigma, and the involvement of substance use disorders or other mental health conditions. The most common side effect leading to medication noncompliance is weight gain. However, noncompliance to medication treatment leads to many risks, including increased hospitalizations, increased treatment costs, increased rates of suicide attempts, decreased rates of remission, and a 3.7 times higher rate of relapse. Coping mechanisms are behaviors or strategies that can be used to deal with stress or trauma. Everyone needs coping mechanisms. These are meant to help form positive adjustments and maintain our emotions during stressful events. Those dealing with bipolar disorder experience mood shifts between manic and depressive states, and coping mechanisms are important in dealing with these episodes. Families of loved ones with bipolar disorder may also experience heightened emotions while they are taking care of their loved one who is experiencing a difficult time. It is important that they also take time to themselves to develop their own coping mechanisms to support a positive emotional well-being. There are many examples of positive coping mechanisms, including pet therapy, such as fostering, adopting, or volunteering to take care of animals at a local shelter, journaling, walking or exercising, meditating or practicing deep breathing exercises, listening to music, taking a calming drive, speaking to your support system, or counseling. Stigma is an ongoing issue among mental illnesses. Stigma is due to a lack of knowledge or misinformation of the disorder, negative attitudes, and discrimination of those with the disorder. Stigma leads to a lower quality of life, low self-esteem, isolation and rejection of personal relationships, and an increased risk of suicide. Due to isolation and rejection of relationships, those with bipolar disorder may experience unemployment, loss of income, and poor living conditions. It is estimated that 50 to 60% of people with mental conditions do not seek out treatment or care for fear of stigma. Family members or caregivers of people living with bipolar disorder are also likely to feel stigma related to guilt and social exclusion. Caregivers may feel guilty for the feelings that their loved one is being dealt due to mental illness. They may be secluded from their family and friends due to fear of stigma and are more likely to isolate themselves socially. The issue of stigma is something that can be fixed with education on mental illness and positive attitudes towards one another. Something that we can all remember is mental illness is nothing to be ashamed of, but stigma and bias will shame us all. Here's my reference page in case you wanted to look over any extra information. Lastly, thank you so much for watching, and I hope I was able to share something new with you. If you have a moment, if you could fill out this 10-second survey below by clicking on the link. Thank you again.